Here at the Eye Surgery Hastings, we believe that to do things right, you've got to have the right elements built into the foundations of what you do. And there's no passive choice here. You're either choosing to make improvements or you're choosing to not make improvements. We also believe that you've got a duty to continuously look at things with a critical eye.
The question was, why do we do what we're doing? Why are we trying to run our business as an environmentally friendly business? And really it's just that we're trying to treat the whole business the same as we would treat a patient. Look at the evidence base for something, the short-term side effects and the long-term side effects of those of our actions.
Regarding our leadership style, we think that you have to be open to new ideas. One of our mantras around here is there's no such thing as the wrong question. We often find that when we've gone through the different options for a solution, the one with the best environmental focus also has the strongest foundation for us to build on in the future.
We've had to set up systems, buy equipment and decide where we're going on an ongoing basis. And that means we're continuously making new decisions.
So, one of our main advantages is that we're a very small company, and because everybody's involved in the process, we're not afraid of failure, and that's how we make most of our major progress.
We're lucky enough to have weekly Wednesday meetings. The whole team is invited, not anybody is missed out. Meetings bring out the power in people. We can set goals, but these goals are always achieved in a team effort.
Being carbon neutral gives you benefits in two main ways. It works like a treasure map. You can prioritize between different projects, work on this place over here and not on this one over here. Also, everybody gets the concept of being carbon neutral. You don't have to be a medical professional to understand what we're doing here. We also work with a New Zealand company which offsets our carbon by planting New Zealand native trees in New Zealand parklands.
If something is good for the environment, it's good for people. And if it's good for people, it's good for our staff and patients to be around.
And nothing is as good as our own cleaning product, the hypochlorous that we make here on site ourselves. It's a really hassle-free, we don't have any supply chain involved, we don't have transportation. It is really basically just salt and water. And we can clean everything with the hypochlorous, everything from the floors to the eyes and everything in between.
We're pretty heavy electricity users, and we've put as many solar panels as we could fit on the roof. This has been one of the best things we've done. It produces abundant energy, way more than we can use.
And we've got on-site cleaning and sterilization, which gives us complete quality control.
Making changes in the right direction snowballs. So you reach a tipping point where ideas begin to link up and compound. For example, despite seeing around 100 patients a week in our outpatient clinic, we only generate about 1 kilogram of waste.
The medical profession can be a victim of its own success. Because it's built around helping people, it can fall into the cognitive bias that thinking if you're good in one area, you're good in another area as well.
Global Green and Healthy Hospitals has been a really wonderful resource to find. They've got so much information. It's really nice to be able to see that lots of people doing lots of things around the world, and it's nice to be able to share what we're doing with other people, feel that what we're doing is making a bit more of a difference. It's really good to be part of something bigger and to know that the changes and innovations and things that we do over here are able to be shared and hopefully will make some difference elsewhere as well.